Well, good afternoon. I'm glad to be here and be with you all this afternoon. I'm going to talk a little bit about an organizational culture that we've been working on for, golly, 10 years, and we'll just kind of jump into that. We call it conscious leadership or conscious professionalism. These are the kind of topics that I want to cover. We're going to get to mindfulness, but when they asked me to talk at this conference, I said, you know, I have a story to tell about mindfulness, but it's really more part of a puzzle and there's a larger picture, and so that's what I want to do today, is tell you about that larger picture. I moved down to Greenville 10 years ago from Chicago, and when I started going out to talk, when I moved to Greenville, I had to start adding a set of slides to my presentation, which was a geography lesson. So here's South Carolina, and Greenville is in the northwest part of the state of South Carolina. The health system now I'm going to put on my Chamber of Commerce hat. It's a pretty city, lots of awards. Come on, visit us. But the health system that I work for is, it's a very large health system. The blue dots show you that there are 8 different campuses with a total of 13 different hospitals across the system, and lots of physician practices. So we're the largest healthcare system in South Carolina. We are the largest private employer in the state. We have a very big academic mission, so we're an academic health center and a big, strong community mission as well. So this is an organization that within the state is well known and spread across a large geography. Here's just one picture of our flagship campus. So just even on one campus, we're covering a whole lot of territory, and most folks in healthcare can probably relate to this picture. And now my clickers. There we go. So just a quick sort of who we are and what we stand for. I'm not going to read these, but these ideas in our vision, mission, and values really kind of capture the big idea of what we're about. And in each of those statements, there's at least one word that connects us to this notion of embracing the idea of conscious professionalism or conscious leadership, and where mindfulness will come in support of that. So I'll talk about this a little bit later. Just last sort of overview slide. If you look at this organizational chart, this is what is part of what I head up, and what's in the red box is what you would typically expect to see in a hospital or other health system, and it usually reports to human resources, just a traditional training and learning and development group. I report directly to the CEO of the organization, and there's a whole lot more to us than what's traditionally thought of when they think of a learning and development area. We have a team that works on this commitment to conscious professionalism, around training and developing our people around that. We have academic partnerships, in particular with Clemson University and Furman University, about doing research and other kind of best practice works. We have a relationship with the Aspen Institute and support 2 of their fellowship programs, as well as some work we do within the organization around a personality profiling system called the Enneagram. So all of that makes up the GHS Academy of Leadership and Professional Development, and that's what I had, and that's sort of the context in which that's the from which we do the work that we do to infuse these principles of conscious professionalism into the organization. So just as a starting point, let me talk about the idea that conscious leadership at GHS is, we often refer to it as the operating system from which everything we do, it's the platform on which everything that we do proceeds. And it's sort of a core element of our culture, and our leadership culture in particular. So at GHS, we place a really high priority on developing our employees and our leaders, their sense of emotional and social intelligence. We offer a structure and set of principles that are really the armature to develop and invite self-awareness within the workforce and encourage high-performing teams. And finally, we challenge our leaders to be curious and open to personal learnings at all times. And so a question that gets asked in the organization lots and lots is, so what is it about me? Where am I right now, and what can I learn from this situation? And if you ask a question of one of our people, where are you right now? It's highly unlikely that they're going to tell you, they're going to talk about being in the cafeteria on the Hillcrest campus of the Greenville Health System. They know that that's an invitation to check in and think about what's the emotional energy that's going on in terms of this situation. So we've got this business case and a theory that by embracing these, by teaching and role modeling and embracing these principles, we are developing stronger, more nimble teams, that we have higher levels of alignment, that we are getting more things done, and that both as teams and individuals, we're much more focused on what needs to happen. And we often see that the feedback that we get is that there's a lot of personal benefits too. So people are often coming back to work saying, I find myself that I'm talking about this at home, and I'm using these concepts with my kids, with my spouse, and such. So there's a benefit that we think even that personal benefit has a potential retention benefit for us as an organization. So I want to quickly sort of walk through what I will describe as the building blocks of conscious leadership, and from there then talk a bit about how we connect this set of principles to mindfulness. So again, everything that I'm going to fill in the blanks here a step at a time, and everything that shows up in this is all done in support of these ideas of conscious professionalism or conscious leadership. And the first place that we start is this core concept, or this basic premise that all leadership, and actually all relationship, is a conversation, and that in any conversation there are really two elements. The first element is the content. You and I are talking about at a meeting, talking about the budget for the coming year, the content. But the other and bigger part of every conversation and relationship is the context. It's about how we're talking, how we're listening to each other. And at GHS, we offer 4 different models of context, and we do this intentionally with the idea that different people may, at different times and in different situations, be able to relate to one or more of these constructs or the models more easily. All of them work off the idea of the first bullet there. It's that is that we. In the course of any given day, we find ourselves in frames of reference where we're to-me thinking or thinkers, and where we're by-me thinkers. When we're in a state of to-me thinking, we're at the effect of what's going on. We heard about the reactivity of standing in the Starbucks line by Dan Harris this morning when somebody jumps in front of traffic I'm at the effect of those circumstances, and as a result am asking questions like, whose fault is this? Why is this happening to me? So it's just sort of that energetic. On the other hand, the by-me thinker is the person who's asking questions like, how am I creating this? What's my part in making this happen, and taking responsibility to do that? So each of these models, and I won't take time to describe them in detail, but each of these models offers a variation on the theme of to me and by me. The line is essentially, we use that as a shorthand to ask that question, where am I right now? And when if the individual says, I feel like I'm kind of below the line on the situation, they're probably closed, defensive, and so committed to being right that there's a running joke at the organization. I was so far below the line I couldn't even see the line, that in terms of that kind of energetic. Above the line, I'm open, I'm curious, and I'm ready to learn from a situation. The drama triangle, many of you may be familiar with the Karpman triangle. That's the model that we reference with that. And then finally, we take that same construct of to me and by me and say, what does it look like within teams, and how does that work? So for each of those, there's a model, and there's actually we teach these models and talk about these principles. And this is sort of our entry point for self-awareness. It's the framework and the foundation for moving on to saying, you can take a look at how you're showing up, how I can take a look at how I'm showing up based on this model. And then we take that first step into self-awareness and we take it a little further, and we have what we call our essential commitments of conscious professionals or conscious leaders. And there are 6 of them that we've committed as an organization. That these are things that we want to have as aspirations to live more often in the above the line or in the by me frame of reference as we do it. So there's the idea of taking 100% responsibility. What is my part in the situation? How can I make it better? I've already talked a little bit about curiosity, but what we talk about when we think about curiosity is that this is sort of the gateway to learning. And I'll jump down to the last one where it says seeing all situations and others as allies, another opportunity to get curious and learn. We've got aspirations about using candor in speaking and listening, ending gossip in the workplace, and then finally the masterful practice of integrity. When we talk about masterful practice of integrity in a healthcare environment or in any organization, one of the big elements that we really emphasize is the idea that of keeping impeccable agreements. If I make a promise to you, I keep it or I renegotiate. That's the idea there. So for each of these aspirational ideas or these concepts, we also have what we call a commitment and a counter commitment. So there's a to me way of referencing at the effective, the below the line kind of perspective on it, and there's the by me commitment. And so that takes us to what we describe as sort of a deeper sense of self-awareness. So that I've got these constructs, I've got these models for context, and now I have these aspirational ideas, these commitments of conscious leaders. And at GHS, I'm down in the South now. I have to always make the point that when I talk about the 6 commitments of conscious leaders, don't confuse them with the commandments. That nobody's going to have eternal suffering as a result of having slipped up one day. But these are aspirational ideas that we want to infuse in the organization. But it's really with this from here that we have that ability to take that second step down in terms of a deeper sense of self-awareness and invite people to check in. How am I showing up around some of these aspirations for the organization? And here's where mindfulness and other tools come in terms of really starting to then we've got this frame of reference. Now let's talk about how do you work on building the muscle. And so presencing and mindfulness is where we show up in terms of that big idea. And then there are several others. So this is an organization. Anybody familiar with the Enneagram, the personality profiling system? No, there's a couple of hands. So we have several people in our organization who are, like me, certified trainers of the Enneagram, and we also have a group of faculty. I loved if any of you attended the Google session before lunch, the idea of having a lot of the training done by volunteers. We have people who are committed in the organization that I say, hey, I'll tell you what, I'll give you some deep dive training on this stuff if you will make a commitment to pay it forward. And so that's how we do it. But we have about 60% of our 1,000 people in leadership positions and management positions who know their Enneagram style and understand and are sort of on that journey of understanding how the pattern of personality can show up in this work. And then, of course, there are other tools that we use with regard to helping people kind of take that deeper dive and really look at what is it about me, what can I learn from my own situation. And then finally, there are lots and lots of different venues. I've only put a few on this list of how we at GHS bring this information forward. But I'm going to show you some pictures from our new employee orientation practice. We do this at new manager orientation. There's this LDR stands for Leadership Development and Retreat. Every 90 days at our organization, we take everyone from frontline supervisors up to the CEO of the organization off-site to the only place in town that can hold all those people, which is the convention center, and we produce a conference with plenary sessions, motivational speakers, breakout sessions, and so four times a year, our leadership comes together as a community to learn and develop and grow as leaders. And what happens in those meetings is that the language of conscious leadership is just sort of interwoven into just about every presentation. We also do breakout sessions where you're taking the deeper dive, learning about certain concepts, but we're also showing how it's part and parcel of the fabric of the organization. Leadership Grand Rounds are monthly sessions that we do offer to our leaders, and then we have a number of different ways where we pair off individuals or groups of individuals in learning partnerships or communities to take to do more with that. And again, that's just sort of what I could fit in the little box as I was trying to develop this infographic. So let's take a look at mindfulness at GHS, and I just wanted to give a couple of examples of that. And we don't actually use the phrase or the term mindfulness that much. More, we talk about getting present and centering, and we start on the very first day on the job. So every Monday, we usually have somewhere between 50 and 70 people who come into the organization, brand new to the organization. And at 8:30 in the morning on those days, either our CEO or I will be speaking to that group and talking, kind of giving an overview of the organization. We spend a lot of time talking about our vision, mission, and values, and then later in the day, there's opportunity to kind of connect back to that talk and get here. So I've already said something to them about the vision and statement, and when we talk about it, and then what gets reinforced is this word transform, and we invite people to think about the idea that what they've signed up for, in addition to a paycheck and a way to make sure their rent or their mortgage gets paid and their families are taken care of. But what they've signed up for is the opportunity to be a change agent, to look at to join us in partnership with making healthcare better in our region and also in the country by, as we say, transforming healthcare for the benefit and people and communities that we serve. And we also talk about the fact that healthcare is a great place to work if you're somebody who wants to have a sense of purpose or mission in your life and meaning, because there's all kinds of jobs where it feels that way. Even the ones where you support people who are more connected with patients, there's a real sense of opportunity for meaning and purpose. But we say, and it's also, these are pretty stress-rich environments, so we want to acknowledge that this isn't going to necessarily be an easy experience. It's going to be hard work and fulfilling work, And it's here where we feel like this is our first opportunity to introduce the power of a deep breath. So this is probably about lunchtime at or just after lunch on the first day of the job. And we talk to them about something that on day one, that we call 4x4 breathing. And it's essentially the idea of inhaling, exhaling on the count of 4 and doing it 4 times. And we invite it's connected to this notion of we're not going to shield you from stress. It's going to exist, but we're going to give you some tools that will help you manage that. And so here we are. There's our friend Phyllis talking about 4x4 breathing, and then we try it. And I love I asked about 4 or 5 weeks ago, right before the slides were due, I asked if I could get somebody to go sort of do some secret pictures of that part of the new employee orientation. And so they couldn't have come back better, because I think that these pictures capture exactly what happens in that. You look at the 2 people in the front row on the top picture. They look like they've done it before, right? Don't they? They're kind of. And then I love the woman in the glasses in the row behind. She's like, "Where did I show up? You know, what kind of a place is this? You know, with one eyebrow raised up." And our thought is that everybody gets to come wherever they are. We're not, we're going to invite them to this, but we're not going to force it down anybody's throat or anybody's idea. But I couldn't have staged that picture any better than that. That was really fun to see. But I want to show you, so that happens on day 1 and day 2 of employee orientation. And what we tell people is that, this is part of a change that's happening within the organization. We've been doing this for several years, but not everybody who went through new employee. I mean, we have people who have been in our organization for 40 and 50 years. They won't have gone through that kind of training, but we tell them that they're going to see this stuff happen and show up in other places. So we're just kind of planting some seeds, putting things on the radar screen. Another place where this idea of taking a deep breath comes in is our monthly leadership team meetings. And this is the top 200 plus 220 people in the organization come together for a 2-hour meeting. That's always the 3rd Wednesday of the month, and at every single one of those meetings, we start with a centering, and that can be 3 to 5 minutes. Sometimes it's even shorter than that, and different leaders volunteer to lead those centerings, and again, it's the sort of thing that when we first started doing it, we had a lot of raised eyebrows, and today, it's just kind of part and parcel of how the organization functions. So those are just two places where I could get some pictures to demonstrate that. But there are lots of other settings where we do this sort of work. At the executive team meetings, they all start with those sorts of centerings. We have an annual retreat that the top 12 people in the organization go off, spend 4 days together thinking about the future, and we'll usually in those 4 days cover several different topics, ranging from, what's the information technology platform need to be, to who's our next strategic partner and everything. And with each of those conversations, we will often, and actually always, bookend the conversations with a guided meditation of some sort to anchor us back into these principles of conscious leadership that we talk about. I mentioned the quarterly development retreats. Those again start with a centering. 1,000 people in the convention center, and you can hear a pin drop in that room. Lots of other different places where that happens. Now, we've got a real intention around why we do this group work. Here are some of the reasons that we do it. First of all, the repetitive nature of that group activity is helping us create both familiarity and sort of ease the discomfort of the unfamiliar at the beginning when it's first introduced. And then the other thing that's happening that we really think is critical is it helps us move towards a common language. And that really applies to everything that I've talked about around conscious leadership principles and the mindfulness practices. It reinforces our culture, and it's a reminder to people that there's something good that happens when we just sort of take those deep breaths. And we often end the centering with that reminder that this isn't just about when the large group comes together. This is practice that you can use every day at any time of day that you need to tap into that work. So just a little bit about how we've been testing our theories. When I showed you that organizational chart with the academic partners, I mentioned Clemson University. We have a relationship with Clemson where we're doing some significant research around, and long-term, we've got a longitudinal study going on with Clemson around our leadership development practices. And we're doing this study in support of a multi-phased leadership theory, and so this is the sort of thing that's going to take us a few years to get to the end of all of the phases, because we're in the if this happens then we expect this, and so we keep moving through that sequence. And at this point, our initial findings, and let me just, before I talk about the findings. These surveys are targeted at leadership, and so again, I mentioned there are about 1,000 people in our leadership team. We get between 60 and 70% response rate in those surveys. So the Clemson, our partners at Clemson are very excited to have that kind of a database to be working with. The other thing that they like about us is that we're able to link the data of these special leadership surveys to our annual employee survey, where the numbers look more like 11 to 13,000 individual participants completing the surveys. So what we're finding, the initial findings are that there's a positive influence for those individuals and those leaders who lean into these principles, who make an effort to learn about them and actually start to practice them. There's a positive influence on work unit performance, and as well as engagement and commitment. We're just sort of putting our toe in the water of connecting this data to other data that we have, but we've seen another early sign that our leaders who lean into to these principles of conscious leadership also are showing up with work units that have higher quality and safety outcomes on the team, and as well as patient satisfaction results. The last thing that I want to point out is that we didn't come up with all these ideas by ourselves. There's a group called the Conscious Leadership Group, and a fellow by the name of Jim Dethmer, who is an executive coach who was our partner 10 years ago. We started working on these concepts with him, actually, and our executive team 10 years ago. And this has been a 10-year journey of periodically just moving the circle out a little wider and a little wider to the point now where we've really captured our leadership, we've captured our managers in this knowledge of this language and these principles, and we're now moving to the whole organization. That's why I use the language of conscious leadership and then quickly follow up with conscious professionalism. What we found was that our frontline people were saying, I don't have to pay attention to this because this is about leadership with the conscious leadership, and we're shifting our language to help this feel a lot more inclusive. The other thing that we're doing, I mentioned that we're an academic medical center. we're beginning to teach these principles to our medical students, with the aspiration or the hope of one day, producing a more collaborative, a more self-aware physician leader that works in our organization and then across the Southeast and the country. So that is, I beat the clock, yay. This morning we had a little speaker's breakfast, and Eric said, if there's nothing else that you know, is you've got to beat the 40 minutes or you're in real trouble. So he got me nervous enough that I made sure I did it. So anyway, I'm more than happy to answer questions and tell you more about conscious leadership, talk about the mindfulness practices that we do, and
I have a question.
yeah.
Thank you for sharing what you did. I think it's quite remarkable. So my question is, how did it all start? What was the one moment, the one thing that made this fantastic program start?
So I came down to Greenville, like I said, about 10 years ago. I had been working at the University of Chicago Hospitals and Health System as the senior staff person to the CEO at that organization. He, a few months before, had made the decision to not renew his contract, and he started looking for another assignment, and he went to Greenville and asked me to join him. So it all kind of started with this guy, Mike Reardon, who was probably, we all might have had these experiences, but I kind of feel like he's the best boss anybody could have. And I was willing to pick up and move. Actually, left my family in Chicago because I thought I was coming down for a couple of years to help them get things started, and then and they're still there, and I'm still there, or down here 10 years later. But Mike had been, when he became CEO at University of Chicago, a few of the board members had recommended, he was the youngest CEO ever to be appointed at U of C, and a few of the board members recommended YPO, the Young Presidents Organization, as a potential good resource for him in terms of his own professional development. And in the course of participating in YPO, he participated in a group called the YPO Forum, and in that work started doing his own self-work. And I remember when I was working with him at the University of Chicago, thinking, this guy's kind of special. There's something a little different from it, but I couldn't put my finger on it. We got down to Greenville, and one of the things that he said to me, really actually quite early in our time there, he says, I want to be all of me everywhere. I'm tired of having the family guy and the work guy. I want to show up and fully present in every situation. And so he remembered some of these. He actually remembered Jim and said, let's see what we can do with Jim. And so again, we started with the executive team. And I would be telling you a big fat lie if I told you that 10 years ago that we had any idea about what we would, that I could not have predicted this. So there's been very much an organic approach to this, but it did, I could have just said the CEO.
Just to follow up, that was my question too, but did you encounter any difficulty in implementing these practices, whether it was from the executive level or other stakeholders?
Oh yeah, absolutely. That picture of the woman with the eyebrow raised, I can tell you lots of different examples of that. I remember I used to say that I would get up in front of like new management teams and talk about these principles, and I'd be dressed in a navy blue suit. My shoes would be shiny. My shirt was white and starched, and I had a really conservative tie on, and I would talk about these ideas, and they'd be looking at me, and the picture that I had of what they were seeing was a guy in Birkenstocks, a robe, and dreadlocks. You know, they were like, what is this? Yeah, yeah. And that's why, I mean, I think in many ways, so I meet every 2 weeks with our friends at Clemson to talk about how our research is going and progress. And one of the things that I'm sort of known for is I'm sort of like, they call me Johnny One Note, because I said, all I want to know is whether it makes a difference. I just want to know whether any of this matters. And in the course of those conversations, it's occurred to me that the research that we're doing about leadership development may be as important, these conscious leadership principles, but another way to look at this could be about consistency. We've been talking about the same thing for 10 years, you know, and so in many organizations in the span of 10 years, there could be 5 or more different kinds of initiatives that come and go, and people, you know, there's that sort of worry about the flavor of the month. If we are nothing if not consistent. You know, it's sort of in the privacy of our you know, his door closed, and the two of us, we kind of joke that we're just two knuckleheads who have one good idea, and we just keep doing it again and again and again. But it seems to be something that works. One of the, I'll just offer as an endpoint something that I didn't put in here, but our annual employee engagement surveys. We started out with a baseline survey of 16th percentile in terms of workforce engagement across the country of healthcare organizations. We've been as high as the 99th percentile, and we are consistently in the upper 80th percentiles. And every once in a while, we do something that is needed, that needs to happen, but that our employees get cranky about. And when that happens, they give us feedback, and we'll drop down and then go back up. So, okay. End. Big red letter. Thank you very much.